According to Dr. Marlene Merritt, an expert in the field, understanding blood sugar can be complex. She emphasizes that many individuals lack a comprehensive understanding of how blood sugar levels impact weight loss, energy levels, and overall well-being. Dr. Marlene Merritt explains that when a normal person consumes food, such as oatmeal, the carbohydrates in the oatmeal break down into glucose, which serves as the body's primary fuel. As the glucose travels through the walls of the small intestine and enters the bloodstream, it becomes known as blood glucose, a measurement commonly assessed in blood tests. Hello and welcome to my channel where we talk about all things health. You see, our bodies are incredible machines, capable of performing extraordinary feats and adapting to various challenges. Like any machine, they require regular maintenance and care to function optimally. When we prioritize our wellness, we unlock a world of benefits that extend beyond just physical appearance. Subscribe, like, and share. To effectively utilize this glucose, the body relies on insulin, a hormone produced by the pancreas. Insulin facilitates the movement of glucose from the bloodstream into the cells, ensuring that blood glucose levels remain stable. Once the glucose has been successfully transported to the cells and blood sugar levels have decreased, the body's reliance on insulin diminishes. Alternatively, in individuals with type 1 diabetes, the pancreas fails to produce insulin, leading to high levels of glucose in the bloodstream. Without insulin to regulate blood sugar, the excess glucose circulates throughout the body until the kidneys detect the elevated sugar levels and remove it through urination. This is how doctors in the late 1800s initially identified type 1 diabetes, through the observation of urine that attracted ants to its elevated sugar content. When a woman peed on the ground and the ants came to her urine because there was so much sugar in it. In summary, the process of blood sugar regulation involves the release of insulin in response to food consumption, which allows glucose to enter the cells. However, in cases of type 1 diabetes, the absence of insulin prevents the body from managing blood sugar effectively. During the mid-1980s, a significant shift occurred in public health policy regarding saturated fat, with concerns raised about its association with heart problems. This led to the adoption of a low-fat health policy, which encouraged individuals to consume minimal amounts of saturated fat. As a result, dietary recommendations included options such as whole grain cereal with skim milk, a half banana, a small glass of fruit juice for breakfast, and a sandwich consisting of low-fat turkey, whole grain bread, and baked potato chips for lunch. Additionally, individuals were advised to consume snacks like whole grain granola bars in the afternoon, and dinner options typically included pasta with vegetables or baked chicken with rice, without adding any butter. This low-fat approach caused frequent fluctuations in blood sugar levels throughout the day, as it involved consuming a substantial amount of carbohydrates beyond what the body's normal capacity could handle. Over time, this constant fluctuation in blood sugar levels led to a breakdown in the body's ability to regulate them effectively. As a result, the body started predicting the intake of carbohydrates, leading to excessive insulin release when blood sugar levels began to rise. This excessive insulin caused the glucose to be removed from the bloodstream and stored in the cells. However, the surplus of insulin remaining in the bloodstream had a few effects, including sugar cravings and an increased desire for more carbohydrates. The presence of insulin in the bloodstream triggered the urge for additional sugar and carbohydrate consumption throughout the day. When someone consumes carbohydrates, their insulin levels increase. Throughout the day, there is a constant fluctuation of insulin in the bloodstream. This can lead to an occurrence known as reactive hypoglycemia, wherein the body reacts by producing excessive insulin, causing blood sugar levels to drop too low. It's important to maintain a baseline level of glucose in the bloodstream since approximately 30 to 40% of brain function relies on it. Consequently, low blood sugar due to excessive insulin can result in cognitive difficulties, fatigue, irritability, lack of concentration, and memory problems, as the brain is not receiving adequate nourishment. This is commonly referred to as reactive hypoglycemia or low blood sugar caused by excess insulin. Moreover, insulin presence in the bloodstream inhibits the burning of fat, further compounding the issue. This creates a situation where there is a lack of energy from both blood sugar and stored fat, leading to constant tiredness. As a result, individuals may experience sugar cravings and consume carbohydrates to raise their blood sugar levels and subsequently feel better temporarily. It's worth noting that besides a decline in blood sugar, other effects accompany hypoglycemia. The adrenal glands are a pair of endocrine glands located on top of the kidneys. They perform various functions, including regulation of blood sugar levels. When blood sugar drops, the adrenals respond by assisting in bringing it back up. Individuals who frequently consume high carbohydrate diets with fluctuating blood sugar levels can place increased demand on their adrenals. Over time, the adrenals may become fatigued, leading to tiredness. A symptom commonly associated with blood sugar issues and adrenal fatigue is waking up in the middle of the night due to low blood sugar level. This occurs because the body needs to prevent a further decline in blood sugar, ensuring the brain's proper functioning. The prevalence of adrenal fatigue in society can often be attributed to improper blood sugar management. It is important to address hypoglycemia in this context. Constant fluctuations in insulin levels can eventually result in insulin resistance, causing cells to resist picking up glucose when insulin is present. As a result, glucose begins to accumulate in the bloodstream, leading to the conversion of excess glucose into fat. This conversion process involves triglyceride production as an intermediate step. Therefore, elevated triglyceride levels observed in blood tests are often indicative of excessive carbohydrate consumption. In individuals, fat is produced from the glucose present in the bloodstream. However, the constant presence of insulin in the blood hinders the burning of fat. This condition, known as insulin resistance, often leads to metabolic syndrome, which manifests as a collection of various symptoms. In women, metabolic syndrome commonly results in elevated estrogen and testosterone levels, leading to issues such as hair thinning resembling male pattern baldness. For men, it causes elevated estrogen and decreased testosterone, contributing to the development of male breasts and abdominal fat, colloquially referred to as a beer belly. Weight gain associated with estrogen further exacerbates the hormonal imbalance. Estrogen injection is utilized in cattle to induce weight gain, illustrating its impact. The repetitive cycle of high estrogen causing weight gain and fat cells producing more estrogen perpetuates further weight gain. Thus, weight gain occurs due to high estrogen levels obstructing fat accessibility, glucose buildup in the bloodstream getting converted into fat, and the impact of estrogen on fat retention and production. Consequently, it becomes challenging for individuals to lose weight effectively. This progression can be traced from hypoglycemia to insulin resistance, with many patients exhibiting a combination of both conditions. As time goes on, some individuals progress to developing diabetes. This occurs when the body's ability to convert glucose into fat through the triglyceride cycle is compromised, causing glucose to accumulate in the bloodstream. People experiencing difficulty controlling their blood sugar levels often report it being persistently high. The body responds by increasing insulin production from the pancreas to manage the excessive glucose. However, over time, the pancreas becomes fatigued, resulting in the development of diabetes. This entire process represents a progression, yet it is reversible. Alarmingly, approximately 81% of individuals aged 55 and above are either diabetic or prediabetic. Now, this doesn't come out of the blue. It comes because they haven't managed their blood sugar for decades. Basically, it's kind of like this when I describe it to people. It's like you're given a certain amount of points for carbohydrates in your lifetime, and most people have used those all up before the age of, say, 35 and so. From this point forward, if you want to be healthy, you don't get to go back to how you were eating. They're like, we've used up all of our points, now we've got to figure out what to do from this point forward to keep from being sick or ending up as diabetes. This statistic underscores the importance of long-term blood sugar management. Thus, it becomes crucial to adopt healthier dietary practices to mitigate the development and progression of these conditions. Dr. Marlene Merritt's Smart Blood Sugar Program is available as an ebook. It is a digital resource that provides information on managing blood sugar levels and improving overall health. Click the link in the description.